I struggle treating when we treat women with recurrent vaginitis all the time. I mean, I can't tell you how many prescriptions on a daily basis I'm writing for women who have these problems.
Can you tell us what's vaginitis?
Infection in the vagina, which causes burning and discomfort and irritation. It can happen for a lot of different reasons. Most commonly, it can be things like a yeast infection. Probably a lot of women can relate to that. Overgrowth of the normal bacteria that can be abnormal and cause discomfort. It can happen a lot of times. So many patients, they say they take antibiotic or something. A bladder infection, lung infection, something that they're doing, a skin infection. When you take an antibiotic, only about 2% of that actually goes to the site you need. You're taking it orally, it's circulating through your blood. Doesn't matter what part of the body, you only get a fraction of it to go to where you want it.
So you got to take a lot of antibiotics over a long period of time.
It can cause resistance. It can cause other problems, right? They always say, oh, a lot of women get a yeast infection whenever they take any sort of an antibiotic. So you have to treat that. We know that there's good and bad bacteria all over the body. Most commonly, people are understanding it in the gut, right? We talk about gut health and probiotics to keep the bacteria in your colon balanced. We've got bacteria everywhere. Bladder, the vagina, the skin, every surface has some bacteria. When you're always treating these infections, it's always causing abnormal balance, right? It's affecting the balance of the bacteria that can cause problems. In my practice, just treating all the time, and then it just becomes this cycle, and then they get resistance. The other group of patients who can't take the antibiotics for certain reasons, right? If they're pregnant, they might not be able to take the medications. If they have cancer, immunocompromised, other medical conditions,